Pharyngeal arches. Among pharyngeal arches, maxillary process from first arch fuse with medial nasal process to form the upper lip. Therefore, upper lip is contributed by maxillary process, lateral part on either side, medial nasal process, medial part. Lower lip is formed by fusion of mandibular process on either side. Defects: cleft lip. It occurs due to non-fusion of maxillary process with medial nasal process. Bilateral cleft lip. It occurs due to non-fusion of maxillary process with medial nasal processes on both sides. Hair lip or median cleft lip. It occurs because of non-fusion of two medial nasal process in the midline inferiorly. Oblique facial cleft. It is a rare occurrence. It occurs due to non-fusion of maxillary process with lateral nasal process. Nasolacrimal duct is open to the exterior. Deeper aspect of medial nasal process from the front. Medial nasal process contributes to form nasal septum, philtrum of upper lip. Part of palate, which is called the primary palate. Primary palate derived from medial nasal process. Secondary palate is formed from two maxillary process fusing in midline. Both the hard and soft palate are derived from maxillary process. Soft palate. It is unossified part of palate which lies behind the region of nasal septum. Incomplete cleft palate. It occurs due to non-fusion of two maxillary processes in the posterior part. It extends from soft palate towards hard palate. Unilateral cleft lip and cleft palate. It occurs due to non-fusion of two maxillary processes with each other and also with the medial nasal process of one side. Bilateral cleft lip and median cleft palate. It occurs due to non-fusion of two maxillary processes with each other and also with primary palate formed by median nasal process. Incomplete cleft lip, unilateral cleft lip, bilateral cleft lip and median cleft lip. Both the hard and soft palate are derived from maxillary process. Soft palate is unossified part of palate which lies behind the region of nasal septum. Derivatives of pharyngeal arches. Bones developing from various arches. Malleus, part of incus, stapes, styloid process, stylohyoid ligament, greater horn, thyroid cartilage, cricoid cartilage, tracheal cartilage, cartilaginous rings, body of hyoid bone, lesser horn, meccal cartilage. Muscles developing from various arches. Orbicularis oculi, frontalis, buccinator, orbicularis otis, masseter, mylohyoid, pharyngeal muscle, sternocleidomastoid, clavicle, platysma, anterior and posterior bellies of digastric muscle, stylopharyngeus, stylohyoid, occipitalis. First arch muscle, muscles of mastication. Second arch muscle, muscles of facial expression. Third arch muscles, stylopharyngeus. Fourth arch muscles, muscles of palate, pharynx and larynx. Important information. Digastric muscle is a hybrid muscle supplied by two nerves, cranial nerve 5 and cranial nerve 7. Anterior belly of digastric develops from first pharyngeal arch supplied by cranial nerve 5. Posterior belly of digastric develops from second pharyngeal arch supplied by cranial nerve 7. Digastric muscle is a hybrid muscle supplied by two nerves, cranial nerve 5-3 and cranial nerve 7. Anterior